Hello, and welcome to Snap 101 with Feeding Indiana's Hungry. My name is Emily Bryant. Here's our brief agenda for today's training. First, a bit about us, then an overview of the SNAP program, followed by some resources available to you to help neighbors access the SNAP program. Feeding Indiana's Hungry is the state association of Feeding America affiliate food banks serving all 92 counties in Indiana. Our members are the 11 Feeding America affiliate food banks who work with roughly 1,400 agency partners like you around the state. Together, you help distribute 140 million pounds of food in 2024. SNAP is the Supplemental Food Assistance Program. So, what is it that we're talking about? It's formerly called food stamps, so that's a popular term. SNAP benefits help families make healthier choices. For quite a few years, the benefits have not been on actual stamps, but are on an EBT card that's used at a regular point of sale system by retailers like grocery stores, convenience stores, and farmers markets. You see the Hoosier Works card in the top corner.
What does EBT stand for? A, extra biological training, B, electronic benefits transfer, or C, Aaron's best thoughts?
We're talking SNAP eligible foods include breads and cereals, fruits and vegetables, meats, fish and poultry, and dairy products. SNAP benefits cannot be used to purchase beer, wine, liquor, cigarettes, or tobacco, any non-food items such as pet foods, soaps, paper products, laundry detergents, vitamins and medicine, or food or hot meals that will be eaten out.
For which products can SNAP be used? Check all that apply. A, cereals, B, soaps, C, poultry, D, dairy, E, liquor, F, paper products, G, pet food, H, medicine, and I, vegetables.
Importantly, SNAP mitigates hunger for low-income families, children, seniors, and Hoosiers of all demographics. There are points of information key to the application process to determine eligibility and benefit levels. First is the household size. For SNAP purposes, the definition of a household is people who live together and buy and prepare meals together. Rules about SNAP households are: married couples must apply together. Seniors who buy and prepare food with others because they are unable to live alone have a separate budgeting test that they use to evaluate during the eligibility review. If the circumstances are found to exist, there's a different test to see if being considered a separate household is most advantageous to them, and that's something that a senior would find out during the application process. Additionally, children under 22 and living with their parents must apply with their parents. There are special scenarios for roommates, disabled individuals and their caretakers, and others that will be part of the application process. Income is earnings, unemployment compensation, benefits like Social Security insurance, and pensions and contributions. It includes generally money, whether it's earned or unearned. And when we're looking at an income level, the household must be below 130% at their gross income level and a net threshold of 100% of the federal poverty level. There are exceptions for the elderly, who for our purposes are 60 or under, and folks with a disability. And that income limit varies by household size. So here is what we're looking at as far as what those eligibility guidelines are for income. This is for federal fiscal year 25 through September 30 of this year. There are also qualifying expenses that a household wants to report as they apply. Allowable medical expenses are deducted in the SNAP budget if the person who incurs the medical expense is elderly or disabled. Expenses for dependent care for a child or other dependent, which are incurred by a household member and are necessary for the member to seek, accept, or continue employment or attend training and education, comes in the amount of the actual cost. The cost of any adult supervised activity provided to the dependents of any age before and after school or when school is not in session are also allowable. Such costs might include the cost of care, transportation to and from care, co-payments for subsidized care, unreimbursed payments for care, and fees for unused care. Some business expenses are also an allowable expense if the individual is self-employed. Child support payments paid by a SNAP recipient within a household to a non-household member are considered as an allowable deduction if the payments have been ordered by the court. These are all things you're going to look at when looking through the application.
Which of these are qualifying expenses for SNAP? A, dependent care costs. B, child support payments. C, business costs. D, all of the above.
And then assets. Assets are the resources that a household has available. Most often, we're talking about money in checking and savings accounts, bonds, stocks, anything that is easy for the household to liquidate and to access. For most households, that income threshold or that maximum level is going to be $5,000. Citizenship is something that's often talked about with this program. Any natural-born citizen is eligible to participate. A naturalized citizen with an LPR or a legal permanent resident status after a 5-year waiting period, as well as immigrants who are 18 years or older with a lawfully present residence are eligible. Those who would be eligible without a 5-year waiting period include children under 18 who are with legal permanent residence, disabled individuals with legal permanent residence, legal permanent residents that are connected to U.S. military service. And then after that, things get a little muddier based upon some new legislation passed.
Immigrants who are legal permanent residents who serve in the military are eligible for SNAP without a 5-year waiting period. A, true. B, false.
The One Big Beautiful Bill Act that was passed this summer limited SNAP eligibility to U.S. citizens and lawful permanent residents only. It did add the category of Cuban Haitian entrant, which is a very specific classification, and COFA individuals who are eligible. COFA is the Compact of Free Association, so citizens of Micronesia, the Marshall Islands, and Palau, often referred to as COFA migrants. Cuban and Haitians that are admitted under other status are no longer eligible, and we don't know the timeline as to when that will take effect as of this recording. But the 5-year bar for adults remains, and all other immigrants, including humanitarian immigrants, will be ineligible for SNAP. Also important to remember that while we heard a lot of talk about this topic, there is no public charge issue for individuals to utilize the SNAP program and how that would impact their immigration status. As of earlier this year, the Biden administration's public charge policy is still in place and it has not been changed. Changing this policy would actually require the federal government to issue new regulations, and we're monitoring that closely, but as of yet, that has not happened. So under the current policy, most immigrants who are subject to public charge are not eligible for benefits that can be considered under the test, but healthcare, food, and housing assistance are not considered public charge in that assessment. The only benefits that are public cash assistance for income maintenance and long-term institutionalization paid for by the government. That is not SNAP. Additionally, it's important to recognize that mixed eligibility households may apply. The head of the household who's applying for the entire household may not be eligible themselves, but they're able to apply for other family members who are.
A head of household who does not qualify for SNAP may apply for other eligible members of the household. A, true. B, false.
It's also important to recognize that there are rights to language access for everyone who is applying. All clients have the legal right to be helped in the language which they speak. It applies to phone, written correspondence, or visits to a Division of Family Resources office. The Division of Family Resources has on-demand interpretive services for over 200 languages, as well as interpreters for the hearing impaired. If you hear of any issues with this, please let your food bank folks know, and they can let us know. We want to make sure that it's working as smoothly as possible.
All neighbors have the right to be helped in the language they speak. A, true. B, false.
Children, another piece where we are seeing some changes as a result of some legislation passed in the summer of 2025. It's been the case that able-bodied adults without dependents have had a time limit applied to them of 3 months within a 36-month period. Under the law passed by Congress earlier this summer, that is extending to all able-bodied adults without dependents up to age 64 years. It has been 54. FSSA is awaiting guidance on when that change will become effective. To comply with the time limits, those individuals must work or volunteer 20 hours per week or participate in employment and training activities 20 hours per week. In Indiana, the state allows the work to be 80 hours per month. It doesn't necessarily have to be 20 hours per week if it's employment, but the other activities are at a 20-hour per week measurement. And the current 3-year period at which that clock starts for that 3-year ineligibility, it started July 1 of 2024, and it runs through the end of June in 2027. There are some exemptions, and you'll see that some of those are in italics. Exemptions to able-bodied adults without dependents are women who are pregnant, children who are under 18 years old, and at the moment, veterans, those who are unhoused, and those formerly in foster care. The last 3 there are subject to change due to a recent law passed by Congress, but again, we're waiting on further guidance as to when these changes will take effect. At some point in the future, veterans, unhoused, and formerly in foster care will no longer be exempt. Additionally, the One Big Beautiful Bill Act says that the age of the child for people who have dependents, if it is less than 14 and those individuals are responsible for the care of, they may or may not be subject to work requirements. This is new to those time-limited work requirements. Currently, FSSA is looking at how that will be implemented, and there could be a substantial change in how that works here in Indiana. There are several SNAP outreach partners that assist with applications across the state. Our organization doesn't do that. We provide trainings like this. But for many other entities, they have application assistance available, including Food Finders Food Bank in Lafayette with a 16-county service area, Gleaners Food Bank of Indianapolis with a 21-county service area, Hoosier Hills Food Bank with a 6-county service area out of Bloomington, excuse me, and the Food Bank of Northwest Indiana with a 2-county service area, as well as Eskenazi Health in Indianapolis. So let's start the application process. The application timeline is very straightforward. You can submit the application online at an FSSA Division Family Resources office, and there's one in every county, or by mail.
SNAP applications can only be submitted online. A true, B false.
Once that's done, you'll complete a phone interview with a caseworker, and they will help you determine what verifications you need to submit to show and to verify the information that's in your application. The Division of Family Resources has 30 days to decide whether or not you are approved, or 7 days for expedited SNAP benefits if you have very, very limited income. And within 30 days, that SNAP card must be in your hand. They all come by mail. So keep an eye out for mail from FSSA, the state of Indiana, or the Division of Family Resources in your mailbox. If your benefits are approved, the EBT card comes. The household is responsible for reporting changes in household composition. Otherwise, they renew benefits every 6 months with an interim report every 12 months with an interim report every 6 months. New in Indiana is that we now have something called the Elderly Simplified Application Program, by which someone is 60 or older or has a disability, and that is the entire composition of the household. They renew every 36 months. You can also download apps like Providers to track your benefits or use FSSA's system. One caution about using Providers or called, I think now, Propel, that there seems to be some confusion in that clients are giving Propel the credentials to access to their Connect EBT account through Conduit, which is the state's EBT provider. It's created a little bit of confusion and an inability to access Connect EBT to utilize Card Lock, which is another important thing to point out here. Card Lock is available to prevent benefits from being stolen. Many folks have heard about skimming. It has happened to a number of folks in Indiana, and there's currently no federal recourse to replace those benefits. But to help protect those benefits from being stolen, Card Lock is the only method that Indiana has available. It allows you to secure your EBT card and protect the benefits from being utilized. Unfortunately, only 2.5% of EBT cardholders are using this. I would add that the only change required to be reported is if a household exceeds 130% of federal poverty. All other changes would be at that 6-month or the 12-month recertification. Other benefits are not, or other changes, excuse me, aren't generally supposed to be necessary to report. Additionally, there is a benefit portal through FSSA. Having it is not required, but it does allow the household to upload documents and see pending verifications. I want to make sure that we talk about the maximum benefit levels. This keeps going, but this is for households up to 5. The minimum benefit level is $23 for a household of 1 to 2. We've always said it's $20 that you wouldn't have. It does roll over for a number of months. And if something happens, there's an expense occurred, a medical expense, a car expense, or other things, those benefits are there when the household needs them, if they're willing to apply and go through the process. It's important to understand that if households are denied, they can either reapply once the situation changes. Like if your household changes, your income changes. Every October 1, the eligibility thresholds are recalculated based upon factors like inflation. And so if someone applies in the middle of the year and something has changed by October, they can certainly reapply. Additionally, sometimes DFR makes errors. And so there's a process to file an appeal within 90 days of that decision. You can start your appeals by calling the 800 number that the Division of Family Resources has on their website, on the back of an EBT card, if you have one, or available at any of the Division of Family Resources offices. It's all the same number. Additionally, you can contact Indiana Legal Services for assistance. They're able to help with those appeals cases as well. We have some additional resources available to our member food banks and to the agencies that we work with. Feeding Indiana's Hungry's website contains SNAP outreach flyers in English and Spanish under the Federal Food Assistance Programs tab at the top. Those can be downloaded and printed for use as you would like. Coming soon, we will have Burmese and Haitian Creole as well. These are updated annually. They're on our website. They've been reviewed by Family and Social Services Administration to make sure that we've got everything correct. And they are for your distribution and use.
FISH's website contains SNAP outreach flyers in English and Spanish. A true, B false.
Thanks so much for your time today and listening to talking about SNAP outreach. I appreciate all the work that you do for your communities, working and volunteering at the pantry. You all are the most trusted sources of information, and you are a valuable resource to your community. Because if someone is coming to your pantry and seeking help, they're already in a position of feeling uncomfortable, but they're coming and asking you for help. And if you can provide them with a little extra information to help them bring a little extra grocery money into their household, provide a little bit of relief for your pantry, because they'll be able to access those benefits at the grocery store, and provide them the ultimate in client choice, buying the food that they need for their families, that they will eat for their health needs, for their dietary needs, for what their family likes and will eat. And so you play a vital role in making sure that the families that we're serving and the neighbors that we serve are aware this program exists. Thank you for your time and have a great day.